Swayam Prabha. Digital India. Educated India.
Welcome to Module 10, where we will start discussing on municipal health services. And Lecture 46, we will talk about healthcare facility standards, and this is part 1 of the lecture. So, in this lecture, we will cover certain points which are in relation to public health, national health standards, URDPFI guidelines in relation to healthcare facilities, National Health Mission and National Urban Health Mission, which was launched in 2013, and finally the National Health Policy 2017. Now, starting with public health, Winslow has defined public health as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. So that means we are not only trying to we prevent disease, but we are trying to improve the life or extend the life. We want to promote general good health. So it's not only when we talk about public health, it is not only about curing some disease or preventing some disease, but also improving the quality of life, improving the overall wellness of a particular community. The Constitution of India also in its different articles, such as Article 21, guarantees that no person shall be deprived of his or her life or personal liberty. So, this life is not only the physical life that we are talking about, but also the quality of life and different aspects regarding the overall wellness of life. And the Article 47 also directs the states to raise the level of nutrition and the standard of living and to improve public health in different areas. Now, accordingly, in the year 2005, the National Rural Health Mission was set up, and or this is known as NRHM, and now it is of course known as the National Health Mission. So it is not only rural, it is both rural and urban. So that's why we have the National Health Mission, which is NHM. Now, the basic motto that was thought of in this National Rural or National Health Mission is attainment of universal access to equitable, affordable and quality healthcare services, accountable and responsive to people's need, with effective intersectoral convergent action to address the wider social determinants of health. So again, it's not about just physical health, but also overall health, and the overall health of the society is also being talked about. And the other thing is, it should be universal, it should be universally accessible. That means everybody should get access to this. It should be affordable, and also the healthcare should be of particular quality. It should be proper quality. Now, there are whenever a government sets certain some missions or some programs, governments are not only aligned with the need for our own country, but there are some international commitments as well. So this 34th World Health Assembly held in 1981, it has talked about global strategy for health for all. So India is also aligned to this, and this talks about removal of obstacles to health, elimination of malnutrition, ignorance, disease, contaminated water supply, unhygienic housing. So, Government of India is also aligned to work in this particular direction. So, the primary thing that came out is health for all. That means we have to provide universal health care for our population. Now, the 12th schedule of the Indian Constitution, this we have discussed earlier, where public health, sanitation, conservancy and solid waste management is one of the key responsibilities which have been given for ULBs after the 74th Amendment. So, you can see that public health is a big part of the responsibilities of the ULB, and it has to be as per the following the different, the government policies or the government missions, and it should also be aligned with the international commitments of the government as well. So accordingly, Government of India has set Indian Public Health Standards, or shortly known as IPHS. This was set in the year 2007 and also revised in the year 2012. And currently we are also revised that, and we have the new guidelines for 2022. Thus, we will cover in the next lecture. But over here, this was the initial, this why we are discussing this, because this is where it says what kind of healthcare needs to be provided, what should be the standard of that healthcare, and how it is implemented is not stated over here. It just says, it gives us the guidelines and the standards which has to be followed while setting up this kind of facilities. Now, every ULB or every state or every administrative body for that matters, they can adjust this as per their own convenience or as per the local context, but overall these are the guidelines which has to be adhered to. So this kind of guidelines ensures delivery of quality services for all citizens. And what kind of guidelines it talks about? It talks about infrastructure, what sort of infrastructure should be there in this kind of facilities, what sort of human resource, what sort of number of doctors, number of nurses, and all the technicians, all this is also listed there. What sort of drugs should be available, what sort of diagnostics and can be done, what sort of equipment is required, quality and governance requirements. Then it also talks about, in general terms, about health services which should be equitable, accessible, affordable and responsive to population needs. So that means overall these standards are designed in such a way so that health services are equitable, accessible, affordable and responsive to population needs. But at the end of the day, we have to create some list of facilities, some list of infrastructure, some list of human resource that is required to manage this kind of operations. So overall, these standards are given for 4 category of facilities. One is the sub-health center, which is the smallest form of or the smallest way you can respond to population needs. Then primary health centers, community health centers and sub-district hospitals and district hospitals. Beyond that, there are medical colleges, you can say, which could be called as tertiary facilities, which we will learn later. But over here in Indian, this IPHS 2012 guidelines, these are the 4 kinds of categories that we find. Now, why this is important? Because when we come to urban planning or we talk about the services that has to be provided by our health care facilities in urban areas, all this national guidelines, national standards, this actually determine how those should be provided. So this guidelines has been utilized by your DPFI. As you know that your DPFI gives us gives us actual guidelines what has to be done in the urban areas in regards to healthcare facilities and for other things, of course. But when we talk about healthcare facilities, your DPFI guidelines, the estimates for how much area is required, what kind of healthcare facilities has to be provided is developed from this national Indian public health standards, and based on the recommendations of these standards for this kind of facilities, those has been taken up and accordingly your DPFI have provided their guidelines. So some of these facilities are listed over here in this particular table. You can see over here. These are the your DPFI guidelines for healthcare facilities. So it talks about for 15,000 population, there is a need for 1 dispensary, and that has an area requirement of 0.08 to 0.12 hectares. For nursing home, child welfare and maternity centers of 25 to 30 beds, it is population served would be around 45,000 to 1 lakh. Again, this is the area required. Then for different categories of polyclinic, intermediate hospitals, okay, different categories are there, multi-speciality hospitals, specialty hospitals. These categories are taken from the health standards, the Indian national health standards, and it also states how many number of beds would be there, and also what kind of population it will serve, and the total area required for setting up these facilities. Now, using this kind of guidelines, we can determine how many of this kind of facilities would be provided in urban area. But it never talks about what combination of this facility should come and in what hierarchy this should come, right? So that also has to be looked into. So, for example, if you think about the four categories, it actually talks about four categories of hospitals. So, you have got district and sub-district hospitals, then you have got primary healthcare facilities, then you have got this community healthcare facilities. So, there are different hierarchy of healthcare facilities. So, over here also you have to understand that we can give certain number of beds. Now, some of these beds could be available in a general hospital, some of these beds could be available in a multi-speciality hospital. So, how many beds are required for the entire urban area, that needs to be determined, and then we can determine what sort of facilities are required, and that is based on many other things, many other criteria, such as what kind of diseases are prevalent, what do the people want, and all these things, right? But more or less, these guidelines give a very, very broad idea about what sort of facilities is provided and for what population, what sort of facilities are required. But what happens during overlaps of in infrastructure, like all these institutes have got different kinds of infrastructure, and then there are overlaps, then how do I share that? That is not listed here. Similarly, URDPFI guidelines also talks about some trauma centers. Like for example, as per the suggestions of the Department of Health and Family Welfare, trauma centers should be set up along highways, and it cannot be just under any ULB's jurisdiction. It has to be under probably the highways jurisdiction, right? So that these are provided so that in case of accidents and all, some emergency treatment could be taken up, can be done over there. So it should be positioned suitably along highways at certain locations after certain distances maybe, and it should have doctors trained in emergency medicine and trauma care with adequate emergency management technicians supported by efficient ambulance system. So that is how a trauma center should be also designed, in addition to the other facilities that we discussed earlier. Similar to that, for hilly areas, you can see that here the provision of facilities is more aligned with what the government recommends. Why? Because government recommends, the recommendations are for public health, right? That means these are government facilities which has to be provided, and this is usually for the different vulnerable, for the entire population of the country, right? But when we come to urban areas, then there are, in addition to that, a lot of private facilities, then there are a lot of institutions with certain kinds of facilities which are there. So those kind of facilities also give additional support to the healthcare system. So that's why in urban areas, in addition to basic facilities such as primary healthcare center, hospitals, you get polyclinics, multi-speciality clinics, and so on. And some of them are also provided by private players. Same goes for many dispensaries are set up by private players as well, right? In addition to government dispensaries. But when you come to hilly areas, usually it's not it may be urban, it may not be, but usually you see the level of facilities are more aligned with what government recommends for provision of public health. So that is where you find hospitals are recommended with 200 to 250 beds, and this population served is around 20,000, and distance between two facilities are also given because these are hilly areas, so at least some minimum distance has to be given, which is 16 to 20 kilometers, and the area that has to be reserved is also given over here. For nursing homes, family welfare centers, health sub-centers, dispensaries, also the number of population served, the distance between two facilities, and also the area range are given. Now, why the distance is important? Because our hilly areas have got a lot of ups and downs. It's difficult for people to travel. You cannot travel long distances. It takes up a lot of time. So, in addition to the population served, which could be spread out on a large area, the distance is also given as an additional criteria for determining how many of these facilities are provided. Now, next we will discuss about the National Health Mission and the National Urban Health Mission. This has been set up in proposed in 2013. So as you can understand, the rural mission is now converted into National Health Mission, and we have National Health Mission, we have got two parts to it, the National Urban Health Mission and the National Rural Health Mission. So accordingly, different budgetary allocations are done for these two missions, right? Now overall, in the 2013, it was this entire, this rural mission now got converted into the National Health Mission, and then again Urban Health Mission and so on. The reason is, when you really look at our public health, our country is growing, our cities are growing, we are getting more affluent day by day. So of course, there are some improvement in healthcare provision, there is growth in the healthcare industries, but the urban poor is still vulnerable, the urban poor still suffers. So there, when we talk about public health system, of course, it should be focused towards the urban poor. So accordingly, the National Health Mission or the National Urban Health Mission focus, when this new guidelines came in, then it was determined that the urban poor are the one who suffer from the most poorest health status, and they should be catered to, or they should be the focus of these missions. Under 5 mortality rate in urban areas is around 72.7%, whereas the overall urban average is around 72.7 out of 1000 baths and all, whereas urban average is around 51.9. So overall it's 51, whereas for the poor it's much higher. So there has to be some amount of effort that has to be put in to reduce this particular gap. Now 46% of urban poor children are also found to be underweight, and 60% of these children also miss total immunization before 1 year. So as you can understand, lot of children in urban areas really miss out on the healthcare services, and that should be the focus of provision of these services. The other aspect is, urban areas also contain a lot of slums. A considerable portion of urban areas are slums, and usually these slums have got very poor environmental conditions, and that leads to a lot of diseases. So we find a lot of incidents of lung disease like asthma, tuberculosis, and also a lot of vector-borne diseases such as malaria and all this, which happens in the slum areas. So the focus of the National Urban Health Mission is to particularly focus on the urban poor, whereas the other, the private facilities and all that are provided in urban areas, that comes up in urban areas, they are usually not catering to the urban poor. Mostly they are catering to the urban middle class or the urban rich class. So that's why government should focus on the urban poor. So the motto of this particular mission is to provide affordable primary health care in urban areas through UPHCs, urban community health centers, urban primary health care centers, and outreach services, and particularly for residents of slum areas. So the services has to be taken to the slums. We cannot wait for people to come to us. We have to design systems so that we take our services to the slums, to the homeless, to the rag pickers, to the migrants and other vulnerable groups. So we have to design our services for this healthcare services so that we do a lot of community outreach, we can go door to door, and we can provide a lot of services. So that we will discuss in subsequent lectures. So ULBs should also formulate the broad norms for provision of these services and setting up of different sorts of infrastructure that are required. So usually this National Health Mission talks about 3-tier structure of primary, secondary and tertiary care facilities or services. So as you can understand, primary care is the first order. That means it's whenever you have some problems, you can reach out to the primary care. Secondary care is the next order. That means if that is not treatable in these primary centers and all, then you have to go to secondary order facilities. And then there are specialized care where secondary order facilities in an area cannot handle that kind of problems, then it has to be sent to tertiary care facilities, which could be district hospitals, sub-district hospitals, or even multi-speciality hospitals or medical colleges and so on. So that is how the 3-tier system is being developed. So that is, so if I talk about this is again as a, you can see this particular pyramid. So at the community level, where we really need to do a lot of outreach, where we have to create these outreach points And we can also provide it through public facilities, mostly government facilities, but some independent private service providers could be also brought in, and also school health services are also included in this. So these are known as community outreach services. This is the tier 1. Tier 2 is the urban health center, where this is primary level healthcare facility, which is provided like the guidelines suggest around 1 in 50,000. But in slum areas, it should be around 25 for every 25 to 30,000 residents in slum areas. There should be one of this, and this should strengthen the existing public healthcare facility for extending services to unserved areas. And finally, referrals are public or empaneled secondary, tertiary private providers which are referred to from these healthcare centers, where these people can go and then they can actually keep on continuing with their treatment. So that means earlier these linkages were not there. The new policy said that there has to be referrals. That means if your disease is not treatable here, those would be referred to the upper level where you can go and can treat your disease. But you have to go step by step. So the community outreach is actually where we reach the people's homes, particularly for the poor homes, and we provide services, lot of maternity services, lot of basic healthcare services, lot of awareness generation can be created in this through this. The second is the actual, the first responder, you can say, that is where you first, in case of some problem, where you first go, that's the primary healthcare level. And the final is the referral level or higher order facilities where people can also go. So the national health, so based on all these changes that is happening, and based on this national health mission and all, the government has come up with a new national health policy 2017, which gives us direction on how we should design our healthcare services. So the first big point is shift from maternal and child mortality, because this was our target during the last 20-30 years, that we were trying to improve maternal health and child mortality. Now we are now growing, our country is growing, our economy is growing, so we can move beyond that, and we are now looking into non-communicable and some infectious diseases. So there are incidents of lot of non-communicable diseases and also some infectious diseases. So that is what should be our focus now. So we are moving, we are not leaving this, that is already there, but now we are also focusing on this. Now the other issue that we should be really looking into is because our healthcare cost. The healthcare cost is rising very, very fast, keeping pace with the international and the national, different drug producers, different kind of service provision and so on. So it's becoming very difficult for the poor to afford this kind of services. So the national policy should be such that poor should be provided these services to as much, freely as possible. So in addition to that, again, looking into the international, this commitments, we have moved on from the Millennium Development Goals to the Sustainable Development Goals. And Sustainable Development Goals talks about inclusion of all groups and provision of health for everybody. So that is the focus of the national health policy as well. So three objectives, primary objectives: progressing towards universal health coverage. So we have to gradually progress to that. It cannot be possible in one day, but we have to reach there. Reinforcing trust in the public health care system. People have started feeling bad about the public health care system. They know that it's inefficient and so on. But we have to bring back people to the system, and the public healthcare system really needs to be upgraded, and align the growth of private healthcare sector with the public health goals. So that means we have to also take some measures so that the private healthcare sector is also aligned, so that the overall national public health goals can be matched. In addition to that, there are a lot of specific targets which are given in terms of how much should be the mortality rates for maternal health, different parameters of maternal health, child mortality, and other things that are also given, which are specific targets that we have to attain this within a certain time frame. Now, in general, if I talk about the national health policy, in regards to the clinical care part, we are moving on from curative to preventive, promotive and rehabilitative, so that we reach comprehensive wellness. So that means it's not only curing of a disease, but also taking measures which prevents the disease in the first place. Promotive means in addition to normal disease, treatments and all, there should be other wellness, health promotions and all, which should promote the overall health of the people or promote wellness among the people. And also rehabilitative measures in case something has happened. So how to total go for rehabilitation and so on, and so that overall wellness is achieved. So that means that is the first way we are now changing focus in the new national health policy. Then primary care. So instead of selective care, we have to move on to comprehensive care, so that the entire, once a person comes with his problems, it should be treated to the maximum possible extent. So with referral hospitals connected with primary health centers and so on, so we have to provide comprehensive care. Then drugs, diagnostics and emergency services. User fees, cost recovery. Earlier it was we have to collect some amount of user fees, some amount of cost recovery has to be done to make the system sustainable. But now because we are looking into sustainable development goals, universal healthcare, we have to provide free drugs, diagnostics and emergency services in public hospitals. So now in all public hospitals, we are not, these medicines, diagnostic services, emergency services are all free. Infrastructure and human resource development has to come. It should be following a instead of a normative approach to normative approach. That means that following a distribution, we can say that okay, we will focus on this particular area and so on. It should be a targeted approach for some vulnerable groups and all. Instead of for everybody, instead of for all areas, we should select vulnerable groups, unserved areas, and then we should provide our services there, so that we can bring these people up. And in regards to urban health, comprehensive interventions toward primary healthcare delivery and referrals with focus on urban poor. And national health programs like the national rural and the urban health missions and all, it should be integrated with the healthcare facilities and the health system, and then accordingly the all budgeting, all infrastructure creation, infrastructure provision, all these things should be aligned so that we can give better quality of services. So that is what the national health policy is all about. So these are some of the references that you can study. To conclude, healthcare facility standards for urban areas are defined by the Indian Public Health Standards, which in turn help us to formulate the guidelines for their implementation in urban areas. And these standards are based on the overall national health policy and needs to be modified gradually, considering the growth of the country, economy and the living standards and aspirations of the people. Thank you.